Hi and good day. We are from Group 8 and we will be presenting on our business proposal plan.
History. Medicare Pharmacy was established on January 2020 and located at Taman Pansar Sitara Ceras. It is an independent pharmacy and owned by Miss Evelyn with a size of 1,200 square feet. It aims to expand their service with some changes to their layout. Our motto is "We care for you," and business hour is from Monday to Sunday and closed on Friday. Some of the product offers in Medicare Pharmacy include medication and OTC supplement wound care products, rehab as toiletries, medication aids and refreshment product. Services include pharmacy counseling service and medication review and health checks. Management of business. Medicare Pharmacy is led by Miss Evelyn, who is the pharmacy manager, and assisted by Miss Wani, who is the pharmacy assistant, and Miss Habiba and Missing as retail staff.
As for human resource, our community pharmacy has a manpower of 4, which consists of a pharmacist manager to do prescription screening and dispensing, a pharmacist assistant to assist our pharmacy in preparation for dispensing and to do counseling, and our retail staffs to respond to our customers' need and inquiries besides being cashier. All our employees are entitled to beneficiaries such as allowance, SOCSO, EPF, education and training. Besides, our staffs are also given increment based on the individual performance. On the right are the list of the suppliers from whom our products are procured. One of the strengths of a community pharmacy is its location, which is strategically situated in a highly residential area. Besides, we also have a wide range of products in both over-the-counter and prescribed medications. Our friendly staffs are undeniably the pillars of strengths, as they are not only well-equipped with knowledge, but are also well-trained in patient-centered communication to meet the needs and demands of our customers. Perhaps the only weakness is the competition due to many newly established community pharmacies in our surrounding area. However, we can overcome this by coming up with innovations to improve our services, by introducing newly extended pharmacy services such as mini medication therapy adherence clinic, home delivery of medications, and a drive-thru service.
Alright, moving on is the proposed mechanism. Proposed mechanism is the mini MTech clinic, where the service includes assessment and also intervention, where we will guide patient in correct method of taking medications and also method to avoid mismanagement. Besides, we also help patient to improve the adherence issue. As follow are the plans that we are going to carry out for the patient. So next is the delivery service, where it's called Post to You. We ensure the continuity of medicine supply and assist patients who are busy and lack of time. Besides, we ease the patient that has problem with transportation. However, medication price will be fixed according to sale price and will be charged with postage fee according to area. Besides, patient need to meet criteria to enjoy the service of delivery.
Drive-thru medication service is proposed to ease customers in receiving medications and save their time, especially customers who are busy and in a rush. However, there are few criteria to be applicable for this service, which is first, have good knowledge on use of medications and devices. Second, patient's adherence level, especially patients with chronic diseases, are well established. The layout consists of 2 stations, which Station 1 to collect prescription, screening and filling, Station 2 for dispensing, payment and counseling.
Mini MTech service, we will be providing 4 complete courses to ensure patient's therapeutic target is achieved. So for the first session, we'll be taking medication and medical history, and next we'll be achieving the therapeutic target for the patient and continuous medication adherence in the patient. And the 4th session will involve the disease control, where we will monitor improvement in disease state in terms of objective, subjective parameter, medication side effects, patient's knowledge and perception, and preparedness to self-manage.
Diabetes mellitus is a major health concern in Malaysia and related to increase of complications such as retinopathy and stroke. According to study, good glycemic control reduces the risk of complications, and therefore our target is to identify possible barriers to adherence or effectiveness of medication and make interventions. For warfarin normally comes with different strengths and can be confusing to patients, which increase the possibility of medication error. Our aim is to give thorough guide and plan to use warfarin and allow appropriate action of intervention to be taken if needed. This is to maximize the benefits and minimize the risk of adverse events.
Next is the hypertension management, where hypertensive patients will experience absence of symptoms. So they normally underestimated the importance of continuity of medication. Hence, we are to identify any barriers to adherence and also side effects that are faced by the patient. Next is the family planning service, that we are to provide a safe space for patients to talk about their problems and planning, and to provide consultation on contraception to help them to prevent unintended pregnancies and to space birth. As follow is the fees charged for 4 complete courses of MTech service.
Next, we move to the marketing plan. The location of our pharmacy is located at the corner of the shop lots. It is surrounded with residential areas, shops, office, restaurant, cafe, supermarket, and clinics. And our pharmacy is expanding from 1 shop lots to the 2 shop lots. And for our target market population, of course, the residents and the visitors. And for our additional service such as mini MTech, we target the elderly and also the polypharmacy patient. And for the drive-through and delivery, we target the adults and the young adults. Next, identifying the major competitors at the Taman Pancasitra Ceras consists of first Caring Pharmacy and Watson Pharmacy, both are the chain pharmacy. Next is the Lifestyle Pharmacy, which is a franchise pharmacy, and also the YP Pharmacy, which is an independent pharmacy.
Moving on to pricing strategy, we will be using cost plus and psychological pricing for the cost of each product, and the products will be advertised through official website and social media. As for selling strategy, one-on-one interactions with customer and FIFO system will be conducted in our pharmacy. Membership is one of the strategies to keep the customer loyal to us. New members will be offered with free general screening for BP and blood glucose, as well as free reusable bag for shopping use in the future. Besides, good and close relationship with the customer will attract more people to come to our pharmacy.
Moving on to the financial part. The income source for the first 2 months will be mainly on sales for prescription medication, sales for OTC and non-medicinal product, and also from the loan. Starting from March, there will be additional sales of product due to expanded service on drive-through and delivery. There is also additional income through mini MTech. The monthly operating cost in January and February will be 28,255, while the monthly operating cost starting from March will be higher due to the extra cost in pharmacy hiring and also extra cost for the expanded service. In the first month of operation, the annual fees for business registration, license, and insurance are added. These are the list of capital costs for the first month. The total capital cost for the first month is 88,805. There is a renovation fee for the capital cost in March due to the expanded service.
This is the financial planning part, which consists of initial costs, sources deferred, and loan repayment. Cash flow is done from startup, which is in January, until the end of the year. The income in the first 2 months is different from March, as new service has initiated and the sales is increased by 5% monthly. Increased sales lead to increased total expenses. Based on the profit and loss forecast, the expected annual net profit will be 1,126,460.61 cents.
Moving on to the practical method. For operational plan, we will operate our pharmacy on weekday for 12 hours, on weekend for 7 hours, and we will be off on Friday. And for security plan, we will install security alarm, CCTV, digital electronic corridor lock, fire emergency evacuation plan, and also fire extinguisher. Since we expand the services of our company, so we will purchase some equipment and material to run the services from suppliers like Tantilang, Wei, Samsung Malaysia Electronics, and also multi-standard packaging max. In addition, the stock of the medication and product will be increased to meet the extended service, so the products will be supplied from suppliers like Pharmanica, YSP Industry, Control Pharma, GSK, and fellow medical supplies.
So for the future perspective, we aim to collaborate with physicians for diagnosis and prescription and proceed with medication purchasing and counseling all in one go. Next is the e-commerce platform, where we will develop a mobile application to ease the transaction and delivery of drugs with built-in features that help to monitor and remind the patients and give proper education to the patient. Next is collaboration with the government to align the healthcare delivery system by resource sharing and referral system. With that, we are able to improve the patient outcome.
Moving on to the model layout. Our pharmacy is unique with the presence of the drive-through stations. Station 1 is for collection and screening of the prescription, while Station 2 is for payment and collection of the medication. Besides, we also have a mini MTech room for patient counseling service. Next, we have two storerooms. One is to store the goods for delivery service only, while the another room is to store other stocks. Moreover, we also have prescription counter that is facing the entrance so that it is conspicuous and easier for customer to seek for pharmacist help. The following diagrams show the 3D model of the pharmacy from different views. And that's all from us. Thank you.